Imagine learning 12 facts about erections that are so surprising. A few might change how you think about your body forever. Some will make you smile, some will make you pause, and at least one will make you say, "There is no way that is true." I am Dr. Lauren Hart, a urology and men's health expert, and I create clear science-based videos to help you understand your body and protect your health. If you appreciate straightforward, respectful education without gimmicks, you are in the right place. Share this with a friend who needs it, and make sure you subscribe so you never miss what really matters for men's health. 12 surprising facts about erections. Erections can happen before birth. Babies can be born with erections. In one study that followed male fetuses at roughly 36 to 39 weeks, ultrasound measurements captured multiple episodes where the penis was clearly erect, lasting anywhere from 5 to 17 minutes. The exact trigger is not fully understood, but it appears to be part of the developing nervous system testing its circuits and practicing reflexes long before a child takes a first breath. The penis is not a muscle. Here is a myth I hear all the time. The penis is a muscle that you can pump like a biceps. It is not. The penis is made of 3 cylinders of spongy tissue, the paired corpora cavernosa on top and the corpus spongiosum underneath. During an erection, blood fills the spaces in that spongy tissue, and the outflow is briefly restricted, creating firmness and length. You can train the pelvic floor muscles that support erections and ejaculation, but you cannot lift weights with the penis itself because it is not a skeletal muscle. Morning wood is a sign of health. Erections do not only happen when you are awake or aroused. Men of all ages experience nocturnal penile tumescence, commonly called morning erections. The average healthy male experiences 3 to 5 of these episodes per night during phases of REM sleep. They are believed to help maintain the health of erectile tissue by ensuring regular oxygen-rich blood flow even while you sleep. If you stop having morning erections and nothing else in your life has changed, that can be a useful signal to talk to a clinician about circulation, hormones, sleep quality, or medications. Human ancestors had penile spines. Early human ancestors and many mammals like chimpanzees have small spines on the penis. Scientists think these may help displace competing semen or increase sensitivity. Humans lost the genetic switch that creates these spines. That loss is linked, intriguingly, to changes that supported a larger human brain and may have allowed for more intimacy, longer sexual encounters, and more complex pair bonding. In short, we traded spines for bigger brains and richer relationships. Shoe size doesn't predict size. Let us settle a very common anxiety. Shoe size and height do not reliably predict erection size. Studies show wide natural variation in penile length within populations, and simple body metrics like height or shoe size do not give accurate forecasts. Genetics plays a role, as do health factors. Obesity and smoking can negatively affect penile health and perceived size. Do not judge yourself or anyone else by a shoebox. Orgasm and erection are separate. Here is a liberating truth. Orgasm and erection are related but separate processes. Many people experience orgasm with an erection, but orgasm can occur without one. The pathways for muscle contractions, pleasure perception, and climax can still function even when the penis is not fully erect. This is particularly important for men working through erectile dysfunction. Pleasure, intimacy, and climax remain very possible while you are improving erection quality with medical guidance. Penile fractures are real. You can injure the penis. A penile fracture is a rare but serious emergency that can occur during vigorous sexual activity when an erect penis is forcefully bent. Certain positions, like reverse cowgirl, are commonly cited examples. The classic signs are a sudden popping sound, immediate loss of erection, significant pain, and swelling. Prompt medical care is essential because surgical repair often leads to better long-term outcomes for function and curvature. Growers and showers is a real phenomenon. You may have heard people say they are growers or showers. That casual language points to a real phenomenon. Showers have a flaccid length that is fairly close to their erect length. Growers have a modest flaccid size that increases substantially with erection. Neither pattern is better. They are simply different presentations of normal anatomy. Cornflakes were invented to stop lust. Here is a piece of cultural history that borders on unbelievable. John Harvey Kellogg, a physician and health reformer in the late 19th century, promoted a bland diet to reduce sexual desire. He believed spicy, flavorful foods inflamed lust and saw sexual desire as dangerous. He helped popularize a very plain breakfast cereal, cornflakes originally without added sugar, hoping it would dampen libido and discourage masturbation. Smoking can shorten the penis. If you need a reason to quit smoking beyond your lungs and heart, here it is. Smoking damages the delicate blood vessels and nerves that supply the penis. Over time, that can reduce elasticity in erectile tissue and promote scarring, a combination that makes erections weaker and can even shorten the apparent length of the penis. The hopeful side of the story is that quitting, especially if you are younger, can help you preserve normal erections. Death erections are physics, not desire. There is an unsettling phenomenon sometimes observed after death known as a death erection, or, historically, angel lust. It is rare and most commonly associated with certain types of death, such as hanging. It is not a sign of arousal. Instead, it appears to result from blood pooling in the pelvic region when muscle tone is lost, combined with specific nerve reflexes. It is anatomy and physics, not desire. A significant part of your erection is internal. Here is a fact that surprises many men the first time they feel it. A significant portion of your erection lives inside your body. The erectile tissue continues from the visible shaft back into the pelvis where it anchors to the pelvic bones and is surrounded by muscles and supporting structures. This is also why weight gain over the pubic mound can make the penis look shorter from the outside. The penis did not shrink. Fat in the area is simply covering more of the base. Protect your performance. If you take only one message from all of this, let it be respect for your body's design. Erections are not just an on-off switch. They are a symphony of blood flow, nerve signals, smooth muscle relaxation, hormones, sleep quality, emotional context, and overall health. Morning erections can be a useful barometer for vascular health. Lifestyle choices like quitting smoking, managing weight, staying active, sleeping well, and strengthening the pelvic floor genuinely matter. Curiosity about your own anatomy is not vanity. It is wisdom, and if you're ready to take your results from good to exceptional, let's talk about natural support for your performance, stamina, and confidence. I have 2 supplements that I recommend, and you'll find both links right below this video in the description and in the pinned comment. For circulation and strength. For men who want a noticeable lift in erection strength and circulation, I recommend an organic watermelon extract rich in L-citrulline. It's clinically shown to boost nitric oxide, open blood vessels, and support firmer, longer-lasting performance. For a complete upgrade, if you're looking for a stronger, more complete upgrade, one that supports not just blood flow, but also testosterone, stamina, and prostate health, then you'll want the Advanced Performance Formula. It's a powerhouse blend of Aryan, Tangali, fenugreek, nettle, and citrine. These are the same ingredients I discuss with my patients who want to restore confidence, performance, and vitality at any age. Take a look, see which one fits your goals, and start giving your body the support it deserves. Thank you for watching. See you in the next video.